Welcome to the Real Bleed experience.
Your patent-pending Real Bleed Surgical Simulation Kit.
Designed to support 4 stations with 4 specimens, this system allows for high-pressure perfusion of harvested organs and vessels, creating a realistic surgical training environment with active bleeding simulation. This single pump continuously circulates fluid through all 4 stations, returning it to the basin for a self-sustaining rolling system. No need for refills after setup. Step 1. Set up stations and specimens. Arrange your stations using check pads and trays. Lay out specimens securely. Step 2. Prepare the basin. Fill the basin halfway with water or use real blood if applicable. Step 3. Position components. Place the basin in a central location. Place tubing ends with splints inside the basin and feed opposing ends out. One of the splints will have a male connection. Connect the tube with the male end to the pump with red female connection. The tubing ends with female red dot, position 1 at each station for return fluid back to basin. We will connect to the models in later steps. Connect your delivery tubing, the separate tubing pack, to the pump. The delivery tubing pack has a male connector with a blue dot. Connect this to the pump with a female blue connection. Lay out the tubing matrix so that a female delivery end with a blue dot is at each station. At each station, you should have a female red and female blue connection, one for delivery, one for return. Step 4. Connect traction needles to specimens. Identify entry and exit points for the traction needles. Lay the vessel flat on the surface. Insert the traction needle midway along the shaft. Slide a zip tie underneath the vessel. Secure the zip tie hand tight over the needle. Cross-clamp the zip tie with hemostats to create a watertight seal. Step 5. Connect the system to models. Attach return tubing with red dot for returning fluid and delivery tubing, blue dot, for delivery of fluid to the needles attached to the model. Remember, the blue delivers fluid to the model and the red returns to the basin. Plug in the pump and switch it on to test fluid begins to run through the delivery tubing and into the model briefly. This is only an initial test to make sure the system is set up properly. For the system to fully operate, the models will need to be sealed of defects first. Step 6. Close and seal the specimen. Use vascular cinches, suture ties, and zip ties, and any other surgical techniques to close all openings or defects to bring models under pressure. This is great practice for working with tissue and ligating vessel branches. Once closed, we can create the closed loop circulation. The models will come under pressure with slight leakage. However, if there are major defects, the fluid will be directed into the station tray and not exiting the model towards the return tubing. The system will begin to expose hidden defects as the obvious ones are closed and the model pressure increases. The system does not need to run at all times. Only run the pump when needed, testing for leakage and identifying defects, or if simulating a specific surgical situation. During repairs, the system can remain off, simulating a clamp. If you are not ready to activate all stations or want more pressure to one particular station or stations, use the integrated line clamps to control pressure or to completely stop flow to stations. Key components and their uses. Vascular cinches. V-shaped metal tool. Use finger pressure to squeeze the mouth opening over defects in the tissue to provide a quick closure. This is a quick way to close defects and bring models under pressure. Traction needle. Establishes entry and exit points for fluid circulation. Surgical Skills Challenge. Enhance your training experience by engaging in a hands-on competitive exercise. Lab partners take turns creating trauma, cuts, or surgical abrasions. Opponents must repair the damage under a timed challenge. Simulates real-world surgical intensity for skill refinement. Procedures you can perform. Aortic dissection and repair. Aortic dissection and patch repair. Aortic bypass. Both sides with a central dissection repair with a patch placement. Aortic bypass on both sides, plus clamp aortic staple cut to redirect fluid flow to the bypass. These are just some ideas to get the mind going. There is much more creative surgical discipline to be done. Additional materials you may want to gather that is not included in the kit. Patches and graft. microsutures, vascular tray and tools, headlamps and loops, surgical tape, additional plastic basins, eye protection, gown and face mask, extra gloves, bulb syringe, real beam tabletop lighting boom available on our website, timer, surgical staplers and clips, reuse accessory kits available on our website at realbleed.com. Important safety and use notes. Be sure to flush the pump after use. Once pump is disconnected from tubing, run the pump for 2 to 3 seconds to clear any standing fluid from inside the pump. Training and educational use only, not for human use. Contains sharp items, use with caution. Single use only when used with real blood. Dispose after use. Always monitor pump pressure and tubing for leaks. Always use proper PPE or personal protective equipment. Sharp objects included. Handle with caution. For training and educational purposes only, not for human use. Real Bleed is not responsible for any damages resulting from its use. Visit www.realbleed.com for more info.